My name is Karen. Please vote for me in November for the presidency. Vote for me. Write my name, my full name, Karen Crow Weinstein, on the ballot. Please. I'm that third option. I'm that third person who needs to step up and do the work that I'm supposed to do, and that is lead our country by being a president. Vote for me, Karen Crow Weinstein. Write my name on the ballot. We're going to talk about abortion. Abortion is the taking away of a fetus at a certain point in time on the menstrual cycle, so we would develop more and more children, produce more children. Hats off to the families who chose to have children, and they could not have an abortion, but they had 5 children that were good, were in good health. They looked really well. So I went to them and said, I think you're doing a wonderful, wonderful work with your children. Thank you for stepping up for the call to have children. So that's a thought. Now I'm going to talk to you about abortion. Let me explain to you what abortion is. Let me give you the definition. Abortion is a procedure to end a pregnancy. Those 2 different ways. Medication abortion, you use pills. There's procedural abortion, to remove the pregnancy from the uterus. And it can happen with the pregnancy from the uterus. You can have spontaneous abortion. And if that happens, no one should get into any trouble. No medical personnel should have any bad experiences if it's a spontaneous abortion. It's unpreventable. Abortion that happens without any outside assistance is known as a miscarriage or spontaneous abortion. No harm to the medical stuff should be done. It's a spontaneous abortion. These spontaneous abortions do occur in 30% to 40% of all pregnancies. After abortion care, you have to learn that you have coping problems. You have difficulty with coping with the situation. With determination, dealing with loss, grief, denial, and anger, just to name a few. I'll continue with determination and coping with grieving process, shed tears, and talking over the sad feelings. Spouses, talk to them. Talk to a prayer, say many prayers, each other. Self-help groups and therapists are all potential sources of environmental support. There's another form of taking care of a soon-to-be mom, and it's called, the pill that's called, for emergency contraception, the morning after pill is a safe and effective way to prevent pregnancy up to 5 days after unprotected sex. There is no embryo to eliminate. And I think this is the way we should go. Take a pill before ovulation, before you even know if you're pregnant. And I think that would help a lot of people, especially those who are not sure about wanting to get pregnant. They have an alternative. other than going to full term with the baby and having medical happenings to the mother or even to the child, while the mother is doing the pregnancy often, a lot. I also know that there is a woman. She was very sick. It was in the news. She's very sick, and she was on television on a commercial. She said she was very sick. She was in a lot of pain, but she survived it. She had to also pay attention and learn how to cope with the pregnancy that she lost. It's very emotional for young women and older women as well. So in my eyes, I think the mother should be allowed to use a morning after pill. Shouldn't be used as a way to eliminate any type of embryo or anything like that. Also, do not shut down the program Planned Parenthood. No medical and non-medical personnel will never have to suffer any consequences for saving the patient's life. Saving the mother and the father both are to do a pregnancy safely, helping Premier to meet all concerns related to pregnancy. I haven't found out the last day that we should have an abortion. It's hard to find that material. I'd like someone, preferably a doctor of OBGYN, to communicate with me what week in the 42 weeks that it happened for pregnancy. How many weeks into the pregnancy can a person have an abortion? Send that information to me, please, and I'll carry it out to my followers, my watchers. So basically, a pregnancy lasts 40 weeks. A baby is considered preterm if born before 37 weeks. A term baby was defined as one born any time from 37 weeks to 42 weeks, before or after the calculated due date. Talked about the cycle of the process of the embryo coming to full term. There are 4 stages. First one is menstrual cycle, and that's having your period. Follicular, the first day of your period lasts, this site, or follicular, lasts 13 to 14 days, ending in ovulation. Ovulation happens once each month, about 2 weeks before your onset of your period. The 4th stage is luteal phase. It's after the ovulation. Cells in the ovary release progesterone and estrogen that causes the lining of the uterus to thicken in preparation for pregnancy. It would be eliminated if there's no pregnancy. I would like to ask the professionals, I wonder when we talk to you. I think the government has a right to do a study on abortion. Get medical doctors, nurses, to perform abortions, to give a small note, knowledge, information, explaining a little bit more about the process of a pregnancy. What week, so last week you can have an abortion, and make sure the mother's healthy. If it's a bad pregnancy, then maybe the person should consider suffering, not to suffer with pain, give her pain meds. One woman, she had a pregnancy and aborted by itself, and with the treatment the physicists did, made that process of abortion, not performed by the doctors, that was spontaneous, and no one should be held responsible for that. But no doctor, nurse, or anybody in the medical field should ever have to go to trial and reset things. That is wrong. And I talk to the Republicans, you just don't blurt out, oh, today, no more abortions. There's no scientific value to address that. Why? Why abortion? You need to do a study. You need to talk to the doctors, OBGYN doctors, high level, and they tell you, the politician, when it's okay to have an abortion. Don't let our women end up in a very bad time in their lives. Work with the women. Help them. Keep Planned Parenthood alive. Let the people go there. Planned Parenthood should stay and not be shut down. Who are you politicians telling the women what to do about their pregnancy? No, that's unacceptable. That's between the doctor and his patient. The doctor, her patients. That's it. And you have the doctors do a study. So I would ask the OBGYN doctors to, and the experts, to decide when to terminate that pregnancy. And remember many of the women who can have a miscarriage, have an abortion. Remember I told you they have to have coping skills pre-treated, and they have to go for therapy. There's a lot involved in an abortion. And it should not be used as a way of keeping yourself from becoming pregnant. Still, for I can't think of it right now. There is a psychological event when the mother studies the emotional recourses of an abortion. Due to politicians' war on abortion is causing death to women who are in good health, can die because of the laws of types of help you can have when you're pregnant. I don't think politics can get in the way of good, healthy medical treatment versus the not receiving medical care by the medical team. Politicians should do research before creating laws. News media do a show on abortion and its concern, and talk about when is the last time to do an abortion. I want the women and men to step up, take responsibility. Boys are just as fault if they're underage. The woman and the boy are engaged in sex and have a baby, gets pregnant. Well, I think the mother and the father of those children should be held responsible. And the boy has to be helping the girl he causes a pregnancy with. He's just as much his fault. The woman can't do it alone. I want the people to know this is important. It affects lives for the rest of their life. Always. Always be in your thoughts. Let's keep Planned Parenthood going. Don't stop it. Keep it going. Politicians, stay away from making medical laws. People can die from you blurting out your ideas without doing a study, like I had mentioned. Keep the people comfortable in and during our lifetimes. Remember, once you're a mom, you have pregnancy, you're a mom. You're always a mom for the rest of your life. So I'd like to say this to Republicans and all other politicians. Please, with the abortion, do not do these actions to your people. Do not do that for these people. You're the leader. You're supposed to know what's best for them and know when to step aside and let professionals make the decisions about abortion. People, vote for me, Karen Crow Weinstein. Write my name on the ballot in November. And I want there to be a study on abortion before we make it go any further. Because one woman had a very bad experience, and after that experience with her pregnancy terminated, she ended up won't be able to conceive another baby. And that's against her will. One other thought just came to mind. What are we going to do when the women stop having children because they're afraid of the consequences? What if they play safe sex and they choose not to have a pregnancy because of the risks? See what I mean? You want them to do something by law, and they're going to say, well, I don't want any consequences, I don't want to have a bad experience, I'm just not going to get pregnant. Pay attention to that, politicians. We might make things worse in our country. Thank you. Be good, do good, stay good. Thank you.